Types of angina and myocardial infarction. Type of obstruction that can be seen in angina, that is mainly due to stenosis or narrowing of the blood vessel. But in case of myocardial infarction, there will be occlusion or complete closure of the blood vessel. That's why there will be infarction or tissue death occurs. So in angina, that is mainly due to decreased blood supply to the heart. The cardiac lesion, mainly the angina, there will be ischemic fibrosis. Due to ischemia, there will be decreased blood supply to that heart area. That's why there will be ischemic fibrosis. But in case of myocardial infarction, there will be infarct necrosis. So here there will be complete closure of the artery. That's why there is no blood supply to the particular area of the heart. That's why there will be cell death and necrosis occurs. After the postmortem of these patients, we can see that in case of angina, there will be the vessels will be grayish white sheen, but in case of myocardial infarction, it will be yellow plaque will be seen in vessel. Okay, it is not that much important. Instead of that, we can say regarding the pain. The pain in angina, that is mainly due to exertional angina. Okay, when the person is doing any physical activities or hard work or stress, that may leads to pain. And the pain will be paroxysmal, mostly it is rapid onset and offset. Last for 15 minutes at least. It is relieved by rest and nitroglycerin. So most of the angina, it is mainly by exertional angina. There will be precipitating factor for angina, and the angina will be relieved by rest and nitroglycerin. But in case of myocardial infarction, the pain will be same as angina. The person have chest pain, then it may radiate to the hand and back of the neck. All these features will be present, but the pain will be excruciating pain, and the person will feel nausea, vomiting, then diaphoresis, that is extreme sweating. When we are observing the patient, we can see that extreme sweating in the patient, okay, in the acute attack. So that is the main feature you can see in myocardial infarction. Then the pain will be rapid onset. It will not be exerted by any of the physical exercise or any of the stress factors. It may occur rapidly. Then it lasts for at least 30 minutes. It's a excruciating pain and lasting for 30 minutes, and sometimes the person may collapse. And it will be relieved by rest, not that much rest. We can give the morphine, oxygen, and then sodium nitroprusside, aspirin, all these drugs in order to relieve the patient pain. Then regarding the ECG changes, in angina, usually the ST depression and T inversion we can see, but in case of myocardial infarction, the main feature is ST elevation. ST elevation will be present for the myocardially infarcted patient. So that is the main feature in ECG. Then there will be the lab test, the troponin I, troponin T, all this will be elevated in case of myocardial infarction, but in case of angina, it will not be elevated. Okay, so these all are the difference between angina and myocardial infarction. And the complication, it is more common in myocardial infarction. When angina is complicated, it may leads to myocardial infarction. If we are not take care of angina, that may leads to myocardial infarction. But when myocardial infarction is complicated, if it is unattended, there may be chance for a loss of life. Definitely death may occur. Then Dressler's syndrome may occur, pericarditis, that is Dressler syndrome, then all these other complications may occur. Okay, so I hope you understood regarding the topic. Thank you.